Hello, world and universe. Welcome to the Trevor Donald Experience. Manifest your truth. If you're new to the channel, please hit that like and subscribe button. And for all my continued followers, I want to say thank you. And this is an opinion-based video channel where I try to open your eyes and ears up to some of the travails and tribulations that take place throughout our cities, our states, our country, and sometimes around the world. And this one is about what is going on with some of our governmental city and county agencies, whether it's the St. Louis Public School Board, the Chicago School Board. Many of these agencies are here to governance and to make sure that each department is taking care of business. But what you're finding in today's time is many of these professionals, we have situations of overspending, inappropriate spending. You have administrators that have a lot of infighting, whether it's through retaliation, harassment, and bullying. No different than what many of our high school teenagers go through, and these are supposed to be adult professionals. And there's been some disruption, not only in our St. Louis City Jail, our St. Louis County Jail with the administration, some things that are disruptive at City Hall, but now we have issues at our St. Louis County Public Health Department where several people and a top staffer has resigned. And let's find out what's going on there. And this is all under the watchful eye of the St. Louis County exec. So here we go. St. Louis County staffer resigns. Senior leader alleges toxic mismanagement at health department. Now, this is supposed to be the department that is supposed to be taking care of people. A senior staffer in St. Louis County's public health department has quit, saying she has faced harassment, retaliation, and bullying for the past year and a half, and a toxic work environment is driving out senior leaders. Emily Varner, chief of the department's health data team, said in a letter to department leaders that Director Kanika Cunningham's mismanagement is prompted 7 top managers, including Varner, to step down in as many months. Now, this is the health department where they're supposed to be taking care of people with health issues, but they're having administrative battles. Moreover, Varner said in an interview that the department is inflating numbers in the county's application for federal money for clinical services. Well, that could bring the feds in if they're doing something illegal, fudging the numbers. Together, the problem poses a risk to public health and clinical services the department offers to some of the county's most vulnerable people, Varner said, who's still employed for the next 2 weeks. She was placed on administrative leave after she gave her resignation notice. To see what's happening internally, the community is going to suffer, said Varner, who has worked at the department for more than 8 years. It's the exact opposite of why we get into the field. Cunningham sent an email to employees in response to Varner's letter, which is circulating among department staff. Cunningham said, "Please know that the county takes allegations of discrimination or harassment conduct very seriously and will not tolerate inappropriate behavior in the workplace," Cunningham wrote. "Employees are encouraged to bring such matters to my attention at any time without fear of any retaliation being taken against them for doing so." She asked employees to treat Varner's letter as a confidential personal matter. Doug Moore, a spokesperson for County Executive Sam Page, the St. Louis County Executive is kind of like the mayor of the county, who appointed Cunningham in 2023. So this position was appointed to Cunningham, declined for comment. Varner said the 6 other senior leaders who have left their position in recent months had similar concerns. The Post-Dispatch confirmed the departures of the Communicable Disease Response Director, the Change Management Officer, the Strategic and Quality Management Director, the Health Center Administrator, and the Deputy Director. The Chief Medical Officer quit her position but remains employed by the county. All of those people left. At least 4 of them wrote letters to department leadership, Vollner said. Laura Klasner, the strategy and management director, wrote in a November 15 letter that she was resigning because of retaliation and because she no longer felt like a valued senior leader in this organization. She said, I'm not leaving due to pay, wrote Klasner, who started working for the county in 1995, almost 30 years ago. I am leaving because I am no longer empowered to do my job. Klasner declined to comment for this story. Vollner ran the health department's data team, which manages health records, produces public health reports, and tracks infectious diseases. Vollner said her problem started after she lost 5 staffers, almost half her team, to layoffs in December of 2023. She wrote in a letter. She lost another to a change to the county's remote work policy and another who left for a new job. Vollner tried to work with Cunningham and other department leaders to find ways to reduce costs without laying people off. Vollner offered to cut vacant positions, among other things, but Cunningham didn't agree. Cunningham told her and the city council that the layoffs were due to a reorganization, but the reorganization never materialized in the year that followed, Vollner said. She said she never saw a plan, though she asked for details and for guidance about how to talk with her staff about layoffs. I would anticipate that as a division director, I would be included in conversations, plans, as has been done in the past. The team's workload doubled with only 6 employees left out of their original 13, Vollner said. In May 2024, Vollner was placed on a performance improvement plan after health department leadership expressed concerns about her work. Vollner's letter says, and Cunningham called her a poor leader. Prior to 2024, Vollner had satisfactory performance reviews all the time. The same month, attorneys with an outside law firm questioned Vollner as part of a human resources investigation connected to the layoffs. Attorneys asked for her opinions of Cunningham and the county executive. They also asked if she had ever heard of anyone say that Sam Page was evil or called him a robot. And remember, Cunningham is the St. Louis County Health Director. After that, Vollner said she was left out of decisions for key projects, such as choosing a new vendor for electronic health records. She said her boss, a senior health director, stalked her outside of the bathroom, yelling during meetings and screamed at her in front of other colleagues. She complained to HR, but nothing happened. Vollner filed 2 grievances that summer with county HR, alleging her treatment was retaliation for questioning the layoffs. She also never received reviews from her performance plan, and nothing was done in response to her complaints about her boss. Remember, that's Cunningham, the St. Louis County Health Director. Vollner told the St. Louis Post-Dispatch, the public health director overall is suffering, the public health department overall is suffering because of mismanagement. She witnessed some problems firsthand. The department's clinical services provide primary care to people who either don't have health insurance or are underinsured. But the department hasn't been able to modernize its digital patient portal where patients can look up information about their visits and health, leading to frustration for patients and doctors. Vollner doesn't work on the clinical side, but she has heard directors in meetings discuss delays in patient care, a lack of providers, and a lack of services. Some contracts have even lapsed. And the department, and the department inflated numbers in an effort to get higher Medicaid reimbursements and discounted prescription drugs from the federal government. Voner said. The department reported in its application to the federal government that it had over 2,000 patients in a month last year. But the clinic saw a little over 6,000 patients all year last year, she said. The numbers in the application are a lot different than what they were seeing. Wow, so this is an unbelievable story. I mean, if you get down to some of the things that they're talking about, this is supposed to be a healthcare department, a healthcare facility for St. Louis County, seeing low-income individuals. And patient care should be the number one priority. But you're having all of these administrative issues, starting, it looks like, allegedly, with the St. Louis County Healthcare Director, Ms. Cunningham. It seems like it's egos that are going on attack with each other. And then if you have a scenario where they're fudging these Medicaid numbers, these reimbursement numbers, and say that the department inflated in an effort to get higher Medicaid reimbursement payments and discounted prescription drugs from the federal government, that's fraud. And the real irony behind this is that your St. Louis County executive, Sam Page, is actually a physician and anesthesiologist. So there is dichotomy and hypocrisy all throughout this particular storyline. Here again, Sam Page is an elected official by the people of St. Louis County. We got to make sure that we know who we are vetting and knowing who we are putting in office. Here in St. Louis, there's been all kinds of controversy about Sam Page. He still works as an anesthesiologist while he's getting the full-time pay as a St. Louis County exec. That's been an issue. Recently, Wesley Bell lost a huge lawsuit as he is going to the U.S. Congress in a harassment case recently that I'm going to talk about. There's been a lot going on in St. Louis County politics. And now you have the St. Louis County Health Department that has allegations of Medicaid, Medicare fraud, inflating numbers to get higher reimbursements, falsifying that they are seeing more patients than they're actually seeing. And this could be a real issue and could not only bring in the state, local, and state officials and authorities, but also could bring in the feds because you're dealing with federal money. So this, here again, a lot of people are working every day doing their own thing and not paying attention to what's going on. And there are a lot of people that go to our city clinics and go to our St. Louis County clinics, whether it's for medical or dental services, and have no idea that all of this nonsense is going on with the people that are supposed to be running these facilities. These administrators are having chaos and disruption within themselves and not taking care of the departments that are there to take care of the tax-paying citizens of St. Louis City and St. Louis County. This is unfortunate. And we also have all this craziness that's going on in the St. Louis Public Schools Administration. That's unfortunate. So there are a few brush fires in some of these departments in St. Louis City and St. Louis County. Of course, there's issues with the St. Louis City Jail that need to be looked at, whether it's through Mayor Tashar Jones or through the St. Louis County Executive Sam Page. This is a real issue, and we're dealing with real people's lives that are in the hands of our city and county local politicians and governmental agencies, and something needs to be done about it.